Yeah, you'd written their change or their request
I sent out
on here, yeah. I
just
got
a
that.
little bit. I got a new one, Joe.
Oh, you have?
Yeah. There's a new one. Hi, Dr. Vanetta.
Hello.
Hi, Dr. Vanetta. Can you hear me?
Yes, can you hear me?
I can hear you.
Okay.
And it looks like we have Aaron Beard. Are you there?
Welcome.
Hi, Aaron. Can you hear me? We can hear you. And I think Dr. Joe might be at the door.
Good, Joe. Doing fine. How are you? Doing good.
Hi, someone just joined the meeting.
Had a good fall, haven't we? Yeah, we have. Yeah. Very nice.
Phone number 218-9553. Can you identify yourself, please?
It's Roy Clapp.
Hi, Roy. Hi, John. I thought you were going to Zoom.
Dr. Dill. Not me, I can't Zoom.
Oh, okay.
Yeah, it ain't that easy.
You're supposed to sign something there, Joe.
Okay, yeah. I tried it the last time. I could see and hear you, but you couldn't see and hear me, which means I evidently don't have, I know I don't have a camera microphone on my computer.
When I do them from work, sometimes they can see me and sometimes I'm upside down. I have no idea why that is, because you know I don't turn a laptop upside down to be upside down.
Who am I signing?
And
I think those are the meeting minutes for the last meeting.
Oh, just that one place?
I have to use my landline to call in because they can't hear me. So it's just nuts. Technology is.
Was there a packet sent? Because I couldn't find a packet for tonight on my computer.
Cindy sent me an email, but I think we have an extra one there.
Do you? So I even went back and looked and I was like,
Actually, I think you can take this one to have my name on it. I don't,
if you don't mind, I can give it back.
so no, I put it in.
How's Connie, Joe? Haven't seen her forever.
You're doing fine.
She's good.
This is mean as ever.
No.
Somebody what? Mean what?
That's what
You got a mean what?
that's what he's saying, but I might beg to differ.
She knows better.
I just might beg to differ.
She's been making quilts.
Really?
Every one of our granddaughters, takes all their t-shirts, with basketball and
Mhm.
all stuff, cuts them and makes quilts out of them. And she's got 2 of them to do this year.
I still have a bag of Courtney's to do that too.
Well, she puts them, she puts them all together and puts the backing on them and takes them over to Coons. And they put it over the machine and
Mhm.
actually do the quilt.
I found that bag of t-shirts again in the bottom of the closet. I was like, I'm gonna do that.
There's a lot of work to it.
It is.
Spend a lot of time on it.
And you gotta be so careful. You gotta be ready to do it, because if you don't, the t-shirt will curl. If you cut it before you're ready to do it, it'll start curling if you don't do something with it. And then,
And then you gotta put the, pell on or something.
Mhm.
Put it on pell on.
Yeah.
I'm learning a little bit about
I'm
it.
just saying, Pell on, so
Yeah.
you're doing good.
I'm smart, honey.
I have 6:30, Lisa.
Okay. All right, let's call this meeting to order. It is. Let me move.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Do you think,
I wonder if Dr. Dill's trying to,
What's that?
well, it didn't
We got that.
Okay, if you want to.
Get in the door and we didn't pay attention.
I didn't hear it. Well, we might have been all talking though, so.
How's Cindy feeling?
She said,
Yeah.
surgery.
To just-
You good?
Hi, Dr. Dill. Thank you.
Very tight. Oh,
Okay, roll call?
Okay, Dr. Dill,
present.
Dr. Miller, Dr. Vanetta,
Present.
Lisa Carlin,
Yes.
Joe Busher,
Present.
Floyd Hulkenbrink,
Yes.
Jill Mathenia, Richard Clapp, Joan Beck.
Yes.
I hope everybody got their packets, and has had a chance to review them. We need a motion to approve the agenda.
I'll make the motion.
That was Joe. Dill,
Yes.
Vanetta,
Yes.
Carlin,
Yes.
Busher,
Yes.
Hulkenbrink,
Yes.
and Beck.
Yes.
The next item on the agenda is the motion to approve the minutes from our last meeting, which was September 21st, 2020. Those meetings our minutes are also included in your packet.
I'll make the motion.
Second.
Okay, Dill,
Yes.
Vanetta,
Abstain.
Carlin,
Yes.
Busher,
Yes.
Hulkenbrink,
Yes.
and Beck.
Yes.
I'd like to welcome any of our guests that are present on Zoom. Any comments from the public?
Aaron, Roy, do you have any comments?
No.
Now we need to address new business. Sherry, the financial report.
Okay, the financial report is in your packet. Were there any questions on the profit loss statement?
Not for me.
No, no.
There's no questions. Sherry, do you want to move on to updates?
Yes. We're seeing an increase again in the positive cases for the coronavirus. Per the grant, we've hired the 10 tracers that we were required to hire. They were all hired as contractual employees. So they're not full-time employees of the health department. That way they get a W-9 at the end of the year. And when their contract is over, there's no unemployment paid or anything because they were strictly contractual. And they are doing quite well. In 2 days, we got 78 positives, or maybe a 3-day period, and each one of those at minimum had 4 or 5 contacts. So the tracers are doing really well. Next week, we're going to have the rapid testing here at the health department on Monday and Wednesday from 1 to 5. No appointment will be necessary. Jan Starwalt, who is also one of our contact tracers, she's going to do the test here. And then if it's negative, we're going to recommend that they go ahead and get a PCR test. And if we can get the swabs here early enough, then she can go ahead and do the PCR test and we can send it to the lab. She's waiting to hear back from Sarah Bush if they will accept those.
You said if they test positive or negative,
If they test negative.
don't you trust that test, or why are you doing the second test?
On a rapid test, you always do a follow-up with a PCR test on a rapid test.
Negatives are always true.
Right. Positive is going to be a positive.
Right.
Okay,
But the-
negative might be a positive.
Correct.
You always do that on rapid test?
Mhm.
Well, I know somebody's gonna have a surgery in the next week or so, and they're supposed to go to get a test. They don't get a rapid test. They don't know that they've got to have a follow-up.
They don't get rapid. It's not rapid before surgery.
You know?
No, you don't find out for 24 hours before your surgery. You go 3 days ahead of time,
Right.
do the test, and then they know in 24 hours whether or not you can go ahead with your surgery.
Okay,
But a
right.
rapid test, you know within 20 minutes.
That's not good enough for if they're gonna do surgery, you know?
No, it's not good. A rapid test?
Yes.
No, it's not.
Okay, anyway, go ahead.
Sorry.
Oh, you're fine. I'm glad you clarified.
Been there, done that.
Been there, done that, yeah.
I'm sure you've heard on the news that CDC has changed the isolation and quarantine guidelines. It wasn't until this afternoon that IDPH put out the official notice that local health departments can also start using those guidelines. And starting tomorrow, anybody that tests positive will probably start.
And what are they? I forgot.
It is,
Something about 7 and then 7 to 10 or something.
7, 10.
yeah. What kind of time generally to look?
Do you want me to comment on that?
Here's Dr. Panetta. Go ahead.
Yeah, so they still recommend 14 days as the most as the best way to capture any positive cases. But it is possible because that's quite burdensome, that you might consider for some patients to discontinue quarantine at day 10 if they've had no symptoms. And the estimation is that at day 10, you're probably only missing about 2% of cases or less. Another possibility is that you can discontinue quarantine at day 7 if you have had a PCR test done 48 hours within the past 48 hours. So anytime after day 5, you could test. If you were negative, then you can consider discontinuing quarantine at day 7. The estimate is that we could miss up to 12% of cases by following that particular guideline. So I think it's really important to have that risk-benefit conversation with folks about what your chances are of missing, and still being very conscientious about monitoring for symptoms.
Well said, Dr. Banana.
Hello, Dr. Miller. Welcome.
Well, it took a little while to get in. That link for Zoom was not a valid link,
Uh-oh.
but I worked my way around it and I'm here.
Fantastic.
Did I miss anything?
The financial report is in your packet and there were no
Yep.
questions. And then we were just updating about where we are with the testing here at the health department. We're going to start rapid testing Monday and Wednesday next week. And anybody that tests negative will encourage the PCR follow-up and hopefully be able to do those here and get them sent in the same day.
Is this going to be drive-through testing or do they come into the building?
Because it's so cold, it is going to be a walk-in. And then once they have the test, while they're waiting on it to read, that we're going to have them go back to their car, unless we don't have anybody else waiting, then they can
Okay.
stay.
That will be very good to get the results while they're still there.
Correct. And then we have 24 hours to get them entered in the system so that they show up to the state. And then we were able to get our 10 tracers that the state requires, our contact tracers, and they're doing a really good job getting coverage.
Is the rapid testing as accurate and reliable as the other?
If they test positive, it is. If it's a negative test, we're recommending the PCR.
Oh,
So
The rapid test can, I believe the false negative rate is up to 30%. So that's why it's important to do the PCR test. And I also want to point out that the rapid test really should only be offered to patients who are symptomatic. It is not recommended for patients who don't have symptoms because of how high the false negative rate is.
Is that still a nose swab or that is still?
I'm afraid I could not hear that.
Can you hear me?
I can hear you just fine.
Oh, okay.
It was a man's voice. It was just very distant and muffled.
Yeah, I couldn't hear that either.
I asked about it, if it was a nose swab or if it was saliva, I didn't know which the rapid test was.
the question was, if it's a nose swab for the rapid test.
I assume so.
Yes, it is.
Never mind. I answered my own question.
We're still offering WIC services. The clients call that they're coming. We're still taking them out curb surface. Still doing flu shots, blood draws, all of the other clinical work. Chris has them come in the side door, does everything, and then they go back out and she sanitizes the lab after. And we're busy. We're very busy. We're all tired. Any questions?
With all this testing and so you still do the WIC stuff, is you still putting in a lot of overtime?
Mhm.
You got a lot of tracers do all the tracing for you, and what else would there be due to the COVID?
There is a lot of work involved with it. We have to do quality assurance on the tracers. People call us at home. People call us pretty much with any questions that the contact tracers cannot take because it has to be a staff member. Working with the businesses, they're not closing like they're supposed to, so we are in contact with them, making sure that they're following at least proper precautions. We have updates from the state at least 2 or 3 times a day. Some of them aren't until 7 o'clock at night when they have their meetings. So it's just not, we sit back and let the tracers do the work. We're working as hard as ever because now we have to make sure what they are relaying to the people that they're calling is correct and accurate. So it's just not, that we're, yeah.
Where we stand on vaccines, have they said anything yet as to how?
The governor has released that there'll be the top 50 states, and it's based on the mortality rate. So we've had 11 deaths, so I don't believe we're going to be in the top 50.
Turn on the news on TV that Cumberland County was going to be getting it next week. I'm like, I haven't heard that yet.
Once the shipments do come in, we will be notified because we have to step into the SNS plan basically. And we will have so long to administer when they come in. And we don't know even our allotment yet. The state doesn't even have clarification on how many they're getting yet. So,
It's gonna be a while
A lot of unknowns.
yeah. And then they have redone the phase level. There's phase 1, phase 1A, 2. All of the health departments are revising their mass vaccination plans now. We've already submitted them, and they came out this afternoon with these revisions. We have to have it back to them by Friday. So there again, we'll be reevaluating all of the measures that follows regulars, the SNS Strategic and National Stockpile Plan. So everything we've already submitted has to be redone. They're taking in pharmacies, Pharmacies, you will be able to give them, have to look at the long-term cares. All of that has to be accounted for. So, it's a lot of work to revise the plan. And then we're not sure, we have to put both in whether we're getting Pfizer and Moderna because of the temperature differences.
Right.
We can't get the one that's super frozen because we don't have a freezer that goes that low. And we didn't expend the money to buy one, as most of the ones around us did not either.
They didn't really know that.
No. So I think the one we're getting has to be kept at -20. Yeah. But until the state actually gets it and gets ready to distribute it, we won't know what to look for.
Well, and then it's also gonna be them coming back in, the people coming back in for the
Yes.
second
Yes,
installment.
2 to 3 weeks?
2 to 3 weeks. Yes.
21 or 14 to 20 days.
So whatever shipment we get, we have to hold out enough for their
And that's
second.
for the second set. I wondered if that was gonna be an issue.
So if we get 100, it's really only going to cover 50 people.
Right. So there's gonna be a lot of mathematics that goes into that.
Mathematics. There's already a lot of unrest being reported in the bigger cities about the way it's tiered, who gets it, and threats going on already.
Oh, sure.
Yeah. So it's
I'm kind of concerned because I've heard there are a lot of, that it's not a fun shot to take. It hurts. There's some, major side effects of it. I'm like, how's that gonna affect? Of course, I'm always thinking about my mom.
I was gonna say,
Mhm.
though,
You
the
know,
nursing
all
home
those people in the
population,
nursing
that's the same
home,
thing
is
that I
that
thought
going
of
to
too.
cause?
I don't think there have been increased reports of major side effects.
I'd heard that, it was very painful was one thing, and that the body aches and things afterwards were pretty significant.
I think reports have been similar to all vaccines that cause immune response.
Really?
Well, that's good to know.
Yeah.
Yeah, they had a good review article in the Journal of American Medical Association just a week ago about side effects of it, and they were relatively few.
Good.
When you get your flu shot, sometimes you feel for a day or so like you're coming down with the flu, and then it passes. So you kind of expect that.
Yeah.
And they're not reporting anything more different than a flu shot.
I heard that same thing though.
Yeah. But, still with 95-year-olds, those symptoms could be serious.
Hi, Jill. Did I see you enter the meeting? It still shows her connecting, so we'll give her a few minutes. Okay, any other questions for me?
I don't think so.
So she's trying to connect. Okay.
The next item on the agenda is, in your packet, there are the dates of our 2021 meeting dates. And the first one in January is on the second Monday night because of Martin Luther's birthday, correct?
Correct.
And then the last one in November is because we want to get that last meeting in before the end of the fiscal year.
Correct.
And those are only the two outliers. So if we could have a motion to approve that, please.
You can make that motion.
I'll second.
Dr. Miller?
Yeah, ma'am.
Huh?
I can hear you just fine.
Okay, do you agree to the passing the minutes or the?
Yes, yes,
meeting?
and
Okay.
I
Okay.
think the calendar looks good too.
Okay, Dr. Bonetta,
Yes.
Lisa,
Yes.
Joe,
Yes.
Floyd,
Yes.
Joan?
Yes.
Next item on the agenda is discussion and motion for closed session meeting minutes. And I believe the list of those is also in your packet. And those dates also include what was discussed during those closed session meetings. Closed session minutes, pardon me. And I think we just need to agree to keep them in closed session, right?
Mm-hmm.
So if there's no objections, can we have a motion to do that?
So moved.
I'll second that.
Dr. Dill,
Yes.
Dr. Bonetta,
Yes.
Lisa,
Yes.
Holcombrink,
Yes.
Bet,
Yes.
Mathenia? Jill, are you on?
Motion carries.
Carries.
Next on the agenda is the opening of bids for the carport.
We only had one bid submitted. We did advertise in the newspaper for 2 weeks to accept bids.
Sherry, do you want to explain what this is for?
Yes, the carport is part of the contact tracing grant, and it's going to go out here beside the building. Eventually, when we have flea clinics and whatnot, we can have it, hopefully have the traffic come in, and we can do the clinics under the carport. And then in the summer, when we have some of our education classes, we can actually have things outside. Looking forward, you know, with the WIC, we can have presentations on the food and stuff outside. Our one and only proposal was from Peter's Buildings here in Toledo for a 24 by 24 by 10 carport style building with metal on the sides from 8 feet and up, one end with no post. This does include labor at the prevailing wage. Job materials include 6 by 6 posts, trusses, framing, metal and trim with no ceiling. The bid is for $15,225. And this is going towards the contact tracing grant that we received.
So that money is already in the budget to
Correct.
pay for that. We just need a motion
To
to
accept this
accept that
bid.
bid
Yes.
as it stands.
Mhm.
That's not gonna be a cement floor in there, will it?
There is, but at the moment, no one has turned in a bid.
Well, it's a separate bid,
Mhm.
it's a separate project.
Yeah.
Yeah, cement will be nice.
Yeah, it will, but we haven't had any bids yet.
Okay. Mhm.
Any motion to accept the bid? Because we can only move forward if we accept this bid and then we post for the concrete. Is that how that works?
We can accept this bid, and then when Jeremy said he would work with whoever
Okay.
gets the concrete bid, the bid.
I'll make a motion.
Well, we'll have to accept the concrete bid before we can start.
That's what I wondered too.
Probably yes.
Price or not, I have no idea.
The only one we got.
That's what I was thinking. Sounds hard to me, but I don't know.
Well, but it is local too. That's the other thing.
And he does a good job.
Yeah.
Yeah.
He does that.
They were the ones that did the roof up here.
Mhm.
We've been pleased with it ever since they put it on.
Have you ran an ad in the paper for the concrete and just no one has,
I believe Cindy put them in at the same time.
didn't, yeah.
Concrete people.
And
Is
actually,
it the season?
you know,
It's too cold.
if it came in with less than $10,000, we don't have to have a bid on it. So she may have, when she talked to the different ones getting estimates for the grant when we applied for it, it could be that that's less than the 10,000. And that's the county's ordinance, is that anything 10,000 or
24
more.
by 24 by
24,
24.
24.
Might be.
If it's less than 10, we really don't have to have the bid. But to be fair, you know, we
Sure.
were wanting to do that. So I had Floyd made the motion and Dr. Dill second. Okay. Dr. Miller,
Yes.
Dr. Vanetta,
Yes.
Lisa,
Yes.
Joe,
Yes.
Joan,
Yes.
Jill. She got off, but it looks like she's trying to come back in.
Motion carries.
Motion carried.
I have a quick question. Is this gonna, we talked about a, storage building out there. Is this gonna be alongside that? Is that kind of in that same area right there?
Yeah, and our map, we have it,
Oh, I see it.
I think Ben Bland came down and he told us a
Oh,
good
it's
place
gonna be
to,
up on the street.
yeah, it's gonna be down there so that they could turn in. And then we would still have room for it to come back through between this building and
Yeah,
that
I
one.
see it.
And the storage building is out there. I walked
Correct.
around. It is there. So
Yeah,
it looks very
it's
nice.
there and it actually has stuff in it.
Serving its purpose.
And today we had a delivery of the middle shelving and the semi actually backed up right to it, put his thing down and wheeled it right in there because it was a 900 and some pound pallet and loaded it.
Great.
Good.
Yeah.
Good. The next item on the agenda is the discussion and motion to approve the fiscal year 21 budget amendment number 1, which is in the packet.
And so what we're doing is we're adding an additional $183,126 into the contact tracing line item. Of that 200,000 will be put in the reserves. And then the expenses, we need to modify that line item to be $383,126. On this contact tracing grant, by December 30th, we have to have 50% of the entire grant spent because part of that grant was local cares and part is federal and state. So whatever we don't have spent at the 50% mark by December 30th, we'll lose those monies.
Are we going to be there?
Probably not. So that will reduce whatever we haven't spent off of that 50%. We have to go by what was, I mean, we can do line item transfers, but it is kind of late to get them approved and get estimates or,
Right. Makes sense.
yeah. It's one of those, in the 10 years I've been here, I've never had a grant signed contract and then well into the grant year that they have made amendments because they hadn't got clarification from the feds that we had to go through these hoops to modify the original contract.
Do we have a motion to approve this budget amendment number 1?
Where does all this money come from?
They're printing it up as we speak.
Part of this contact tracing grant is federal money from the local CARES project. The rest is a combination of federal and state money. Yeah, it comes from us, Dr. Miller.
I was gonna say, are they just printing it up?
I think they are. And we think this is a lot of money. What do you think it's like for the counties that have a larger population? I mean, that just make your head
Right, there's
spin.
millions.
Yeah. Absolutely. Okay, so Dr. Dill made the motion. Do we have a second?
I'll second.
Dr. Miller,
Yes.
Dr. Vanetta,
Yes.
Lisa,
Yes.
Holcombrink,
Yes.
Mathenia,
Yes.
Yay.
Ooh, yay, she's back.
Dill,
and Joan.
Yes.
motion carries. The next item on the agenda is to go into closed session. We need to do personnel discussion. Okay, that's all about you on how to do that on Zoom.
At this point, since we're going into closed session, we'll have to ask the guests to sign out. Do you have a number and I can text you? No, it's area code 217-232-3211. And you could just text me, Erin, and that'll be perfect. Correct. Thank you.